Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. The Federal Capital Territory reduced number of first jabs of COVID-19 vaccines for fear delay in consignment of second dose might exceed the 4 to 12-week efficacy window. Government of Ekiti State crosses milestone of rollout of COVID-19 vaccination campaign, says residents are favorably disposed to taking the vaccines. And 23 countries and the WHO support idea to create an international treaty to help deal with future health emergencies similar to the coronavirus pandemic. Last night, the lowest single-day infection was recorded this year since October 22, 2020, when 37 new cases were reported. The NCDC announced 48 new confirmed cases, a sharp decline from the 104 cases recorded in the previous 24-hour cycle, bringing the total number of infections to 162,641. Lagos recorded 13 cases, while Kaduna and Nasarawa confirmed 7 new infections each. Others were reported from Kano, Kwara, Ondo, Akwa Ibom, and Osun State. The health authorities reported 1 death from COVID-19, with fatality toll now at 2,049. The NCDC says that 158 more people were discharged after testing negative to the virus across the country, including 28 community recoveries in Ekiti State managed in line with the guidelines. There are currently still over 10,000 active cases nationwide, while close to 1.8 million samples have been tested till date. Across the world, more than 127 million cases have been reported, and over 2.7 million deaths recorded. Meanwhile, over 638,000 Nigerians have now received the first jab of the Oxford AstraZeneca vaccine, with Lagos the epicenter of the pandemic. Over 122,000 doses have been administered in Lagos. Now, Kogi State has the lowest zero figure, and this according to the National Primary Healthcare Development Agency. The latest figures now make up for 31.7% eligible Nigerians that have been vaccinated. Now, according to the Executive Secretary of the Federal Capital Territory Primary Healthcare Board, the FCT might have to reduce the number of first jabs of the COVID-19 vaccine it is rolling out, as figures indicate that the consignment of the vaccine expected for the second jabs might exceed the 12-week deadline. Now, speaking to Channels Television, he states that this was among the discussions held at the review meeting on the commencement of the phase 2 of the vaccine rollout in the nation's capital. Dr. Ewart says delaying the second jab will reduce the efficacy of the first jab if patients might have to wait 6 months to repeat the entire process. This next report looks at COVID-19 management in the nation's capital, vaccine rollout across councils, hesitancy and conspiracy theories. Our correspondent Kayla Megwa reports.
The Federal Capital Territory Primary Healthcare Board is the agency in charge of the COVID-19 vaccine rollout in the nation's capital. So far, the nation's capital has over 19,000 confirmed cases of COVID-19. Over 2,000 patients are still on admission in the functioning isolation centers across the FCT, and over 17,000 persons have been discharged. 156 deaths have been recorded as of March the 30th, 2021. When it comes to vaccination, of the 3.94 million doses of the Oxford AstraZeneca vaccines Nigeria received in early March of 2021, the FCT got over 227,000 doses, and from its 65 vaccination centers has given the first jab of the vaccine to over 36,000 persons. Health workers like Madam Aisha Galadinchi pound the pavements of the nation's capital daily to increase these figures and ensure the FCT achieves herd immunity by vaccinating at least 70% of its population by the end of 2022.
On Friday, I vaccinated about 250 people, and nothing happened, and they are happy.
people that are complaining that the vaccine can have side effects. Do you see anything like that in the FCT?
Nobody. I didn't hear anything like that.
The vaccines are distributed and managed by the FCT Primary Healthcare Board, and its executive secretary says that rollout may be reduced amid fears that the second consignment of the vaccine might be later than the approved 12 weeks.
We are expecting that these people that have been vaccinated now should have their second dose, and a new supply is expected. But the signals the feelers that we have from the national is like the supply may not be timely, that may not come at a time, because it should come around June, so that you can give these people their jobs. But it appears they may not have that supply by June, and we are being careful now not to use everything for the first dose. Probably if we use half of that, we do 50% of what we have, we use the other 50 and be the second dose in case the one we are expecting doesn't come. So when you are taking and you have been given the optimum time that you should take the second dose to enhance the effect of the first dose, and then you decide to delay, there will still be some effect, but not up to the optimum that we can say that we guarantee your immunity.
So would you have to probably take both doses again?
Sure, but you have to give yourself some time, probably 6 months. The demand from the citizens are even more. The demands from the citizens are more, and it is shocking. I can't explain that.
So we tested this theory on the streets of Garki, Area 10 in the nation's capital. Just how excited are residents of the nation's capital about this vaccine?
Why will I take vaccine? Am I a COVID-19 patient?
I need the one that is homemade. If that is homemade vaccine, fine. I'll vaccine myself 3 times or 5 times. But if it's outside Nigeria, I'm not interested.
Why I'm discouraged is I went to like 2 places. When I got there, I was on queue. Almost how many minutes? At the end of the day, they said that the vaccine has finished.
This issue of coronavirus, you will take a vaccine and you will still be having a social distance with people. You will still be afraid to shake. You will still be afraid to leave your nose open. Then I'm doubting that. Is it true a vaccine or is fake vaccine?
Why are you minding vaccine from China, vaccine from... Do you know the source of that vaccine?
Not so much. Although not everyone is buying the conspiracy theories. At the Garki Area 2 Vaccination Center, these respondents are excited about getting their vaccination.
I feel normal. I don't feel anything, no numbness, nothing. I was expecting it to be more like the injection, but it doesn't feel anything at all.
To me, if I want to be a conspiracy theorist, if you're trying to get all of us in trouble, world leaders wouldn't be taking the vaccines.
The vaccination process is simple. You register your details and the staff makes sure you're eligible to be vaccinated.
According to what they said, it's from 18 years and above. So if they are still breastfeeding their babies, I don't think the baby will be safe.
After you're captured, you make your way to the nurse who administers the painless jab. And your vaccination card is given to you as you wait for the second jab to be administered in 12 weeks. Kayla Megwa, Channels Television News.
For more on the situation in the FCT, Dr. Mohammed Kawu, Acting Secretary, Health and Human Services Secretariat of the FCT, joins us now from our Abuja studios. Welcome. Thank you for joining us on the program.
Thank you so much.
So from that report, we saw lots of skepticism, conspiracy theories, but how would you describe the rollout of vaccines in the nation's capital?
The rollout in the nation capital is going on very well. Since Monday, 15th March, when we flag off with our minister and the strategic leaders and the frontline health workers, the vaccination has opened in all the 65 vaccination points across the territory. And people have been trooping to get vaccinated. I have been vaccinated since then. My family have been vaccinated. All the strategic health leaders in the territory have been vaccinated. So far, so good.
Now, we know the FCT received over 200,000 doses, and we've been told that, the consignment of vaccines might, not be delivered in time for the second dose, and for AstraZeneca, it should be between 4 to 12 weeks. How big a threat is this in the fight against the virus?
Thank you very much. You just had the ES of the FCT Primary Healthcare Board expressing some maybe reservation, and probably is being cautious, so that it's not that when those that receive the first jab, their time for the second jab will be ready and the vaccines are not available. So that is why here in FCT we are going to be very, very careful. We will ensure that we have vaccines available for those whose second dose will be due. So it won't be an issue of having somebody ready to get the second vaccine and the vaccines are finished. We have assurances from the Federal Ministry of Health and the National Primary Health Care Agency that we are going to have the second consignment. When is the issue, considering what is happening across the world, where all nations are trying to conserve vaccine for their citizens. So to be doubly sure, to be extra careful, here in FCT we are going to use 50% of the 228,400 that has been given to FCT and the federal agencies in the FCT while we wait for the next consignment to continue. And I can assure you in FCT, this quantity is going to take the first phase and the second phase. First phase being the frontline health workers and all health workers and not health workers that are working in the health facilities that are most exposed in this pandemic. And the second phase, which is 50 years and above that have comorbidities. So we are confident that this quantity is going to go a long way in attending to those people that are in the first phase and in the second phase, while we anticipate the second consignment. Thank you.
Finally, Dr. Kaur, before we let you go, how receptive are frontline healthcare workers with the vaccine?
Yeah, surprisingly, there are some vaccine hesitancy in some health workers. I was also surprised, especially those working at the PSCs. Those working at the tertiary hospitals and the secondary healthcare facilities and the big private hospitals are trooping to take. But those health workers that work at the primary healthcare, at the interior, they are really having hesitancy. But that I can assure you, we have gone out to engage them and to tell them the importance and the implication of getting this COVID-19 vaccine. So we are getting good response, but initially there were some hesitancy and resistance.
All right, we'd like to thank you, Dr. Mohammed Kawu, Acting Secretary, Health, Human Services Secretariat, the FCT. Thank you for joining us on the program.
Thank you so much. I appreciate it.
The government of Ekiti State says it has crossed the 10,000 milestone of the rollout of COVID-19 vaccination campaign after collating statistics across local governments from the first week of the vaccine rollout. The state's medical officials have administered the first doses of the AZ vaccines for those categorized as frontline workers, with more than 8,000 health workers on the list.
We've had no serious AEFIs. However, we've had some non-serious AEFIs, right? Non-serious AEFIs include having headaches, having pain at the site of the injection, or fever, right? And we've had a number of people who have had those mild symptoms. Typically, from what we're seeing, not just in Ekiti, but also across the country and even globally, these symptoms reside within 24 to 48 hours. Last week, we were training our local government teams so that we could decentralize the vaccination. The beauty is, again, like I said, because we meet every day, we see the numbers. Yesterday's numbers were higher than the day before, and the day before were higher than the first day. So we're seeing a gradual increase in the numbers per day, and I think that's important. Across board, whether it's healthcare workers or frontline workers, those numbers are going up. So it can be better, but we also have to be able to meet the demand. We initially started with 78 teams spread across 16 local governments. So there's no local government as at today where you cannot get vaccinated. We have our vaccination sites across the multiple primary health care centers and secondary care centers in the state. But we've witnessed a very interesting, what we call people's interest to want to take the vaccines. And based on that, we've expanded our 78 teams from 78 to 98. So we added additional 20 teams.
Kenya's Ministry of Health says the East African nation is facing an acute shortage of oxygen in hospitals across the country. This is due to the rising number of COVID-19 cases as the country experiences a deadly third wave, with some Kenyans in private institutions stocking up on the commodity. Health Minister Musahi Kagwe says Kenyans are hoarding some 20,000 oxygen cylinders in private facilities, homes and institutions. Well, Dr. Moses Masika, a virologist from the University of Nairobi, joins us via Zoom. We'd like to thank you for joining us on the program.
Thank you, Millicent, for having me on Channel S TV.
All right, reports say Kenya's ICU beds are filling up. Oxygen's ask us, give us a picture of the situation there.
Well, before COVID-19 struck, we had a very few beds, ICU beds, and also very few infectious disease beds since the outbreak started in March.
All right, well, we try to get Dr. Masika to talk to us on what's happening in Kenya. Let's go over to leaders of 23 countries and the World Health Organization calling about the idea to create an international treaty that would help the world deal with future health emergencies similar to the coronavirus pandemic ravaging the globe. South Africa, Rwanda, Kenya, Tunisia and Senegal are the African countries on the list of countries who gave the treaty proposal a formal backing. The idea of such a treaty was floated by the chairman of the European Union leaders at a G20 summit last November. WHO Director General endorsed the idea in January, but formal negotiations are yet to begin. He's calling for an immediate action on the contract.
The time to act is now. The world cannot afford to wait until the pandemic is over to start planning for the next one. We must not allow the memories of this crisis to fade and go back to business as usual. The impacts on our societies, economies and health, especially for the poor and the most vulnerable, are too significant. We cannot do things the way we have done them before and expect a different result. We must act boldly. Without an internationally coordinated, all of government, all of society, one health approach to pandemic preparedness and response, we remain vulnerable. It has shown how much we need a universal commitment to basic public health principles as the foundation for our work to prevent, detect, and respond to epidemic and pandemic threats. The idea behind the proposal for such a treaty is to systematically tackle the gaps exposed by COVID-19.
Hello and welcome to wherever.
Oh, here we now have Dr. Moses Masika, virologist from the University of Nairobi. Thanks again. You were giving us the situation updates. Also, while you're trying to respond to that, tell us about some of the policy responses in this third wave that's affecting Kenya right now.
Yes, sorry for the audio hitch. We have expanded our bed capacity over the last 1 year due to COVID-19, but even that currently is strained by a third wave that is much bigger than the first and the second wave that we saw last year. And for that reason, we are having not necessarily full capacity ICUs, but the resources that are required to monitor these patients, and especially oxygen, which is needed by many of these severe COVID-19 patients, is not always enough. In fact, we have reports of people on oxygen and then all of a sudden it's over, and some of these patients do pass on because of lack of it. So our resources are currently strained because of a third wave that is much bigger than what we had in the first wave in last year, sometime in June, and also in March, and also in June, and also in November last year when we had the second wave. I think the last week or last Friday, we had our president give a new, or rather a revised version of the policies and guidelines to fight COVID-19. They struck a good balance between protecting lives and livelihoods, as has been the idea before. And this is because we locked down the Nairobi metropolitan area. These are several counties surrounding Nairobi where the infection is most severe, with over 70% of all new cases. And so this is the so-called disease infected zone that no one can move into or out of. And because of that, we are hoping that we'll be able to limit the number of people moving into the rest of the country, although we know COVID is already in those other parts of the country. So this will sort of limit, or is expected to limit, the number of new infections outside those areas, and also focus the resources to the counties that need it the most. We've had, of course, a lot of back push from business caucuses, from the transport sector, tourism sector, and what have you, that are, and even the restaurants and bar owners that are trying to push the government for to cut them some slack so that they can be able to trade. But we've not seen any changes in that front. Of course, there are a lot of people who are suffering because of loss of jobs and income. So the government is trying to balance this with, of course, protection of life. So in my view, I think the policy guidelines are well measured. Of course, a lockdown would have been the best, but that would not be practical, and it would probably pose more challenges. In the meantime, we're also giving the COVID-19 vaccine, not as fast as we should, and that is a common challenge across all African countries because we do not have enough doses, but it's a good step, first step in beginning the process of giving vaccines to the population.
All right, we appreciate your time. Thank you so much. Dr. Moses Masika, a virologist from the University of Nairobi. Thank you for joining us on the program.
Thank you for having me.
Of course, don't forget to protect yourself. Continue to take responsibility. For more updates, take a look at our website and you can be better abreast on the latest trends on the coronavirus situation. That's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.